Hi, I'm Meg Sparker, a pediatric speech-language pathologist and feeding specialist at Emerge Pediatric Therapy. And this is our talk, The Power of Purees.
Hey everyone! My name is Sarah Johnson and I'm a pediatric occupational therapist and part of the infant development team here at Emerge Pediatric Therapy. I am also a CLC, or a certified lactation counselor, specializing in infant feeding. We have dove into the topic of infant self-feeding and readiness signs for starting solid foods with your infant in previous videos, so please refer to those if you need a refresher. But today we are here to talk to you about why, as pediatric feeding specialists, we recommend our infants start with purees when beginning solid foods.
Just like learning any new skill, there's a window of opportunity or a sweet spot for introducing solid foods. When an infant is ready, they are sitting independently, able to hold their head up without difficulty, and demonstrating some interest in foods. This is when you can start to introduce pureed foods. Research has shown that between 6 and 12 months of age, an infant's taste preferences start to form, and a variety of taste and textures can impact food preferences for the long term. This flavor window is when your baby is more likely to accept sophisticated flavors, and introducing a variety of foods at 6 months of age provides a window for trying new foods and flavors and opening up your child to a world of food exploration. In addition to the window of opportunity for tastes and textures, there also appears to be this immunity zone when infants are best equipped to respond to various new proteins, including gluten. And it appears that introducing gluten to a baby before 3 months of age or after 6 to 7 months can increase the risk of celiac disease. Similarly, introduction to cereals, both rice and gluten-containing grains, before 4 months of age or after 6 to 7 months has an associated risk of type 1 diabetes. The immunity window is only one piece of the puzzle when deciding when to introduce various foods to your infant. If you have a family history of celiac disease or type 1 diabetes, it's important to speak to your healthcare provider on when to best introduce these foods to your infant.
So we have talked about both the flavor and immunity windows, but where do you go from there? Let's talk about how to introduce your infant to pureed foods and what a puree food feeding might look like. A question we often get from parents is, how do I first introduce purees to my infant? And there are a variety of different ways you can introduce your purees to your infant, and we recommend experimenting with a lot of different ways to see what works best for your family and your infant. The first way is you can actually spread a puree on a clean tabletop or a feeding tray and allow the infant to interact with their hands. You can model dipping your finger in and licking off the puree and pushing it around on the table so the infant gets the sensory impact of the food on their hands. Another way you can introduce a puree is actually using a spoon. And for that, you would scoop the puree onto the spoon and you would begin to present the spoon to the infant. But once you get close to the infant's face, you're actually going to let the spoon hang out in midair, and you're going to look for the infant to initiate movement into the spoon before you put the spoon farther. This allows the infant to accept the spoon and put their lips around the spoon and be more active in the spoon feeding process. Once the infant's lips are around the spoon, you're actually going to pull the spoon directly out as opposed to pushing the spoon up on the top of the infant's mouth. And the reason for this is pulling the spoon straight out allows the infants to put their lips around the spoon and pull the puree off of the spoon, as opposed to when you pull up on the lip, you're actually compensating for them. So you're pulling the puree off of the spoon, as opposed to teaching the infant how to get a good lip closure and pull it off themselves. If the infant has some puree around their mouth, we recommend avoiding scraping it with a spoon or immediately wiping it with a napkin. For infants, when they're developing their oral motor skills, we want them to experience the puree around their mouth, to practice their tongue coming out to get it, and also to practice having different textures on their hands. So it's best to just let it be and clean the infant at the end of the feed. The final way you can introduce purees is to provide a preloaded spoon for your infant. So you can scoop the puree, you can put it down on the tray and allow the infant to bring it to the mouth themselves. This works really well for infants if they want to be more independent in the process and practice using their hands as well as their oral motor muscles.
If you've heard of baby-led weaning, you may have heard that purees can hinder feeding development, but that's simply not true. Let's break this down from an oral sensory perspective. Your child has developed skills by obtaining liquid from a breast or bottle for several months, and you can incrementally up the ante with a puree by offering a slightly thicker, more flavorful liquid like that. But if you want to incorporate some baby-led weaning practices into your child's mealtime, a safe solid like a relatively bland teething biscuit dipped in a puree is a great way to enhance flavors. You can also try soft steamed vegetables like a carrot or a sweet potato about the size of an adult finger dipped in a puree, and that will allow the child to explore different tastes and textures using some of this baby-led weaning practice. It's important to note that adults consume purees on a daily basis, so it's great for children to have that exposure too.
Another question we frequently get from parents is, what do I do if my infant makes a funny face when I introduce puree foods? This is very common. Infants make a lot of big faces when we're introducing new foods, and it does not always mean that the infant doesn't like the food. A lot of times infants have a big facial response to foods because they're experimenting with it and trying it out. What we recommend is continuing to offer that food, as the research has shown that multiple exposures are how an infant develops a taste for a certain type of food. So continue to offer different textures and tastes, even if your infant makes a face, because over time, as they're more exposed to the food, they may develop a liking for it. Another common question we get from parents is, what type of spoon is best when I'm starting puree foods with my infants? And there are a couple things to keep in mind when looking at spoons for your infant if you're starting purees around 6 months of age. The first thing to keep in mind is the handle. So for a young infant, we're actually looking at a handle that is short and wider because that will be easier for the infant to pick up, and we're looking for a flat area for the food to rest. So this will allow the baby to use the utensil as well as you, and it encourages appropriate lip closure. When babies are first learning to bring spoons to their mouth, they tend to dip and then turn the utensil, and that's their initial motor pattern for it. As they transition into toddlerhood, they will get better at scooping and rotating the wrist to bring the spoon to their mouth. So as they're progressing on, you're going to look for spoons with a deeper spoon bowl to support that oral motor development as they age. Thank you so much for joining Meg and I today on our talk about the power of purees. If you have any concerns regarding your infant's feeding development or development in general, please reach out and we'll be more than happy to answer any of your questions. Thanks so much.